Bernie loves being on the golf course, almost more than anything.
Get down the middle, Bernie.
September 24th, 2013, we saw this guy coming up number 2 fairway, and he's yelling at us, "Would you wait for me?" And we looked over there and I said, "Jeff, who is that?" And he said, "Looks like Bernie."
We had already hit our second shots, and I was in the bunker here on number 4. That's the last really I remember of it at that point in time.
I hit my shot, and I see Bernie laying on the ground just above the trap on the right.
Jeff yells at me, "Norm, Bernie just went down."
So Norm immediately called 911. We're hoping they'd get here as soon as possible.
We got him in position to start heart compressions.
Never been in a situation like that. It was just extremely scary.
I happened to be on call when he came with a heart attack to the hospital. He was not able to sustain life by himself, and he was on life support.
I'm certain he was not coherent of where he was.
I was just numb. It was like, what? You know? Bernie just had a heart attack.
His artery was completely closed, so he was very, very sick.
It was like he was dead. And he doesn't remember a thing.
Time is of the essence.
I was afraid that he wasn't going to wake up.
Hospitals are required to open a clogged artery within 90 minutes. His own case, we got it done within 50 minutes.
But he woke up and he goes, "Oh, what are you all doing here?"
He recovered completely like nothing happened to him.
We really can handle most any situation at this institution. Patients don't have to leave town.
It's like having another chance.
With the addition of the hybrid cath lab to the expansion, we'll be able to provide care for more complex procedures. So I think it's even one step ahead of many bigger hospitals in the country.
I am very optimistic that we from the Heart and Vascular Center will not fail the health system or the community if given more opportunity to grow and expand.
So this is a blessing for us, and we have to keep that into perspective because you never know.
Only God knows when people die, but I can tell you 15, 20 years ago, he wouldn't have made it.
The best part of the whole program was when we finally found out the next day that he was going to make it.
The alternative wasn't very good, so I like this better.
The patient begins to know, oh, it feels my heart. These are my team.
Our main goal is for patients to recover rapidly, get home to their loved ones.
Bernie loves the kids. He does.
You know, with 5 kids and 8 grandkids, there's a lot of activity going on during the holidays and stuff, and it's something you don't want to miss.
It was a lot better once the paramedics were here, because then we were just bystanders.
Of course, Bernie lucked out there too, because we didn't have to give him mouth to mouth.
My sister flew in from Denver, and she works for a cardiologist out there. And when she left, she said, "You're not going to get any better care anywhere in this country." Thank these 2 guys and everybody from the paramedics to the staff at the hospital, the nurses, the doctors, everybody, and just can't tell them how much I appreciate everything that went on that day to keep me alive.
It's very exciting for me to be a part of the vision of the cardiac services of Beloit Health System. It all starts here in our ER, from the emergency care that we provide our community, and it progresses to our cardiac services up on the 4th floor, and the creation of the new Cardiac Center of Excellence in our heart hospital will provide the services for our community that are needed to provide the best care, from our physicians to our staff to the quality of the infrastructure that we provide. Our commitment to you is to make sure that you're getting the best care as a resident of our community.